All right. Good evening, everyone. Tim Richmond, Wapello County Emergency Management. Thank you for joining us again for what we call Thursday's Talking Points. As we told you last week, we plan this every Thursday at 6 o'clock from here at City Hall to update you on the countywide response to COVID-19 and bring you up to speed and current on what we're doing for you, our fellow citizens. In coordination with the Iowa Department of Public Health and Iowa Homeland Security, Wapello County Public Health, Wapello County Emergency Management, the Tumwa Regional Health Center, and the entire Wapello County Healthcare Coalition, we continue to work together to plan for, mitigate, and respond to this expanding outbreak of COVID-19. This evening, we have brought together a panel of 4 of us that have background in healthcare. And between all of us, we have 90 years of clinical experience. And I'll just quickly introduce everyone that's with me today. So Cindy Hewitt, Tumwa Regional Health Center, Linnell Deers, Wapello County Public Health, and Molly Layton from River Hills Community Health Center. And to begin this evening, I will introduce Linnell Deers from Wapello County Public Health.
Thank you, Tim. As we move through a week that resulted in a positive COVID-19 test for Wapello County, anxiety is understandable and expected during this time. But I want to voice my shared concern with Iowa Department of Public Health and the Centers for Disease Control and take a moment and encourage you all to look at a broader picture in terms of changes that have come about this week. Iowa Department of Public Health continues to send the message to social distance and avoid non-essential travel. Governor Reynolds recommended Iowans who have traveled recently for business or spring break vacations, whether internationally or domestically outside of Iowa, self-isolate for 14 days. These recommendations have to become rules that are followed. I still see many people who just aren't taking this seriously and going about their business as if nothing has changed. Our world has changed in an instant. It is now up to you all, our community, to decide what you want your future to be. If you decide you want to do your own thing and disregard the rules, you endanger the safety of us all. I am telling you now, it is the time to change your personal habits by avoiding non-essential travel and staying home when you can. Wapello County Public Health continues to work with our state and local partners to manage testing and monitoring of persons who have been exposed to COVID-19. But our focus is changing to one of mitigation, taking steps to lessen the impact of spread of COVID-19. County health and healthcare partners are increasingly our ability to respond and are planning for a prolonged response to COVID-19. We are on the very tip of this outbreak, just beginning to ascend up the curve of infection. Keeping humans apart from other humans is the only tool we currently have to slow the spread of this virus. This is a problem because humans are social, but we need to make every effort we can to avoid contact with each other. If you become sick, notify your employer and stay home. Keep distance between yourself and family members by staying in a single bedroom and, if possible, only using one bathroom. If you or someone in your house has a fever, cough, and difficulty breathing, call your healthcare provider. Please contact your medical provider before visiting a healthcare office. If you feel your symptoms are severe, call 911. How the world operates in a pandemic is different from how the world operates normally. This is not business as usual. This is a difficult message to share, but it is important to realize how difficult the times ahead may be. Thank you.
Thank you, Linnell. I want to recognize Tim Richmond as being our leader for this emergency management pandemic. He's doing a great job with getting us where we need to go as a county and a community. One of the things I want to talk to you about tonight is what the changes are that are going on within our EMS community. As we continue to prepare and plan for the unknown, we want to assure the community that we have the right teams, the right processes in place to respond accordingly. We want to reassure the community that it is safe to come to the hospital should you or your family need the care. We stand ready to serve you. At the direction of the Homeland Security and the State 911 Office, the following COVID-19 screening protocols have been implemented for our first responders. When you call 911, you will be asked a series of questions about your symptoms, your travel history, your exposure to others for the COVID-19. Then when we arrive at your house, we may not immediately enter. We may stage at the door and be approximately 6 feet away as to not get more exposure. We're trying to distance ourselves. We may be wearing many forms of PPE or personal protective equipment. This may be a mask, goggles, gloves, or a gown, depending on what the situation is. For your safety and the safety of our responders, if you have a respiratory complaint, we are concerned. We will ask you to wear a mask that covers your mouth and nose to protect any droplets that you might sneeze. At this time, the family members will not be able to ride with you in an ambulance back to the hospital. This is a huge change for you and your loved ones, but we're trying to keep everybody safe. When you reach the hospital, you will be evaluated by nurses and doctors, asking specific screening questions while they complete your examination to try to figure out what is going on. We have planned and we prepared for this surge. Please use the 911 systems for emergencies only. Other issues can be taken through the 211 call or any of the local resources by calling your provider. Our goal is to safely treat your illness. We appreciate your cooperation and your grace during this event. It is a difficult time for all. We would like to thank all of our first responders out there in the community to their dedication and passion to helping take care of healthcare. EMS is an important, essential service, and we can't say this enough during the tough days ahead. Thank you.
Thanks, Cindy. River Hills Community Health Center is taking the spread of COVID-19 very seriously. We're monitoring the situation, staying in touch with our local public health officials, and of course our hospital partners. Along with the Healthcare Coalition, we're updating our policies and processes accordingly. COVID-19 is impacting how we live, work, and stay healthy. There's a lot of information about the virus, often changing very rapidly. River Hills Community Health Center is here to help you navigate and help you and keep your family healthy. River Hills Community Health Center remains open, and we are seeing patients in Ottumwa, Centerville, Richland, and Sigourney. Our dental clinics are scheduling emergency patients, and please call us if you have a dental emergency. Medical, pediatrics, women health, and family planning and behavioral health are seeing patients in person, and some patients are now being seen via telehealth without coming to the clinic. To participate in telehealth, patients need a phone or computer with a camera and microphone speaker. At our offices, all entrances remain open to the public. Office hours are 8 to 5, and behavioral health hours have remained unchanged. To ensure the safety of our patients, providers, and employees and the community, all River Health Community Health Center locations are restricting visitors into all clinics. As part of these restrictions, only the patient will be allowed to enter the clinic. No children in the clinic unless they have an appointment. Patients 17 and under with an appointment, one adult will be allowed to be brought with them into the clinic. Anyone entering the clinic will be screened at the door. Your temperature will be taken, and you'll be asked about symptoms and your recent travel. Please allow for extra time when entering the clinic. If you have a fever, cough, shortness of breath, please call us before you come to the clinic. If you're experiencing financial hardship, please don't discontinue taking your medicines or reduce doses. Call us. We're here to help. River Hills Community Health Center providers are working hard to ensure your health receives the highest level of care. We're here for you and your families to help keep you healthy and safe.
I'd like to take a moment to thank all of our collaborators for the continued effort to mitigate COVID-19 in our community. Wapello County Emergency Management would like to assure you, our fellow citizens, that every facet of our local healthcare system has their finger on the pulse of this COVID-19. And the developments in our Wapello County are dialed in to focus on their emergency response plan for pandemic illness. Our partners have spent several years working on our capabilities and building plans and preparing for such a thing. I want to assure you that our community, as a community, we're acting to protect the health and safety of everyone. And I can tell you there's a very dedicated group of healthcare providers that I know personally that are working diligently, very long hours, and are very concerned about this and urging you to take this very seriously. The governor is not issuing shelter-in-place orders for the state of Iowa, at least not now. However, you may begin to see National Guard traffic. I saw quite a bit through our county today. In fact, I met with one of those teams as they did a supply drop for us in Wapello County. Spoke with a couple guardsmen. One of them was an electrician by trade that gladly answered the call to come and help do civil support missions. And the Guard is very good to the state of Iowa in those missions. So they'll be carrying out supply deliveries. They are assisting in some communities with delivering meals and a variety of activities of such. Myself, like many other emergency managers, are working behind the scenes to support public health with supply missions. We want to make sure that our clinics, our hospitals have the supplies they need to continue to see and treat patients. But we still have need. Although the National Guard was able to bring us some supplies today, it wasn't a full order, and we're taking this just a few days at a time. That's how restricted the supply chain is at this point. So I'll put out another appeal to fellow citizens. If you have supplies that could be utilized by our healthcare providers, such as what we call N95 masks, to you that probably is a dust mask or a drywall mask, we would very graciously accept those donations to help us out. We are seeing Iowans begin to take charge, standing up to this outbreak by following instructions and recommendations, much about what Linnell talked about. Governor Reynolds stated in one of her recent press conferences that commuter traffic was down by 47% from DOT statistics and tracking tools. So we know that Iowans are overall heeding the recommendations, but we've got to dial it up a bit. At the same time, we know that truck traffic has remained the same. So our supply chains are intact. Our truckers are doing a great job. So hats off to those that move commerce and move our supplies. Additionally, we'd like to recognize the hardship being incurred by our local businesses as they shut down to do their part. I'd like to give a huge shout out to the Ottumwa Waterworks and all Waterworks employees, regardless of what system, whether it's Ottumwa Waterworks, Wapello Rural Water, Rathman Rural Water, all three serve our county. They've adjusted their responses. Specifically in Ottumwa, I know that those water production employees have sequestered themselves so that they don't become sick, so they can remain on the job to produce water for us. Because if they didn't do that, we wouldn't have the water to wash our hands. We wouldn't have the water for healthcare facilities and all the necessities that we need. So that's a huge sacrifice on their part. I want to take a moment to differentiate between COVID and influenza. Every year there's a widespread community flu that goes around. The difference is that there are steps that you can take to protect yourself from influenza. You can get a flu shot because there's a vaccine. You can take medication like Tamiflu that protects you. And like every other year, this year's flu is going to die out in the spring because it's ran its course. The challenge with COVID-19 is that we can't contain it. We don't know if we're really prepared as a country for this massive epidemic. If we're lucky, we can slow it down over summer, but the next few months look like they're going to be very difficult for all of us. We need to be as ready and we need to be as tough as we can for whatever comes our way. and we know that we'll get through it eventually. We're learning a lot about this virus. It's a new virus. It's not the same as influenza. It's much more aggressive. As a community, we have an opportunity to take actions that we have known affect the slow of transmission of COVID-19 virus and reduce infections in this county by following guidelines to stay at home, avoid non-essential travel, and social distancing. These recommendations have been declared with great thought and care. Citizens are encouraged now more than ever to find ways to support each other as we move through the response to COVID-19 in Wapello County together. Please keep your thoughts and prayers with our healthcare community, our first responders, and others that remain on the front line of this event. Each of you individually will determine the success of this action through your willingness to respect recommendations from our state and local leaders. When this is over, we want to be able to look back and not question if we did enough. Local information on COVID-19 developments can be found on the website, wapelloready.org, and we continue to update that site, and you'll see many changes by Monday. You can also visit the Facebook pages of Wapello County Emergency Management and Wapello County Public Health. And we'll continue to share information, sort through the massive amounts of information, and make it a little easier for you to reference and not have to go through all that multitude of information that's out there. That is the information and updates we have for you this evening. Look to our digital sources for updates every day, and join us back here next Thursday at 6 o'clock. Thank you.